Hi, Sammy. How are you today?
Oh, not too bad. My head is just a killing me.
Your head hurting?
It is.
Okay. So what's going on? You're saying headaches, but tell me a little bit more.
Well, last Saturday I got my flu shot
Okay.
because, everything else I'm all caught up on. So I thought maybe I better do that. So,
Perfect.
um, I don't know if it was from my flu shot or if it was the fact that my hormones are all messed up because I've been changing my estrogen patch like the doctor told me to. But,
Mm-hmm.
after my hysterectomy in March, my head just sometimes I have headaches, but it's been increasingly worse this week.
Okay. So just to recap, you have headaches off and on for a while now, but this last week is kind of becoming increasingly worse. And so that's what's kind of bringing you in here.
Yes. I thought
Okay.
maybe I didn't know if I needed a COVID test or if it was my eyes or what it could be.
Yeah. So, um, thanks for doing a telehealth visit. Before we jump into everything with your headaches and all that, I do have a little bit of data I want to gather from you since this is our first visit. Just standard across the board questions so that we can get people's information and make sure that we're covering everything correctly. Is that okay?
Sounds good.
Perfect. Okay, so let's start with some biographical data. Can you state your full name for me?
Cami Marie Brinkerhoff.
Okay. All right. And then what is your primary language, Tammy?
Um, I only speak English. I never took any of those foreign languages.
Ah, I took some and I forgot it all. So, I mean, we all have our strengths and weaknesses, right?
Right?
All right. And do you want to let me know what your age and date of birth is?
Um, I would be 45 years old because I was
Okay.
born on October 20th, 1975.
Perfect.
I
Thank
was
you.
born in Blair, Nebraska, so I've never been anywhere else besides Nebraska.
All right. That was my next question. So you got me. All right. And then you are a female, correct?
Yes,
All right. And that is also what you identify as.
yes.
All right. Perfect. Are you Caucasian or do you identify with a different race?
Nope.
Okay.
I born and bred a Nebraska girl, and I burn in the summer and um,
Right.
pale
I'm
as a ghost in the winter.
I'm with you 100%. All right. Are you married? What's your marital status?
I'm divorced, but
Okay.
my boyfriend and I have been together for 10 years, so you might
Hey,
as well
that's a
say,
marriage if I've ever seen one. Absolutely. All right. And then do you have any ethnic or cultural origin that you would like to identify?
oh, I'm Scandinavian. My mom is Norwegian and my dad is Danish.
Awesome. I love it. You got a little bit of everything.
Yes.
And then education. What's that highest level that you've completed?
I got a master's degree
Okay.
about 12 years ago.
All right. What'd you get a master's in?
Um, Education.
Education. Okay. And then what is your professional occupation at this time with that?
I'm teaching at the college.
Okay. Perfect. All right. And then we kind of ask everybody, but what about that health insurance? Like, are you a private? Are you a, how do
Well,
you,
that's why I joined with you because you're a Blue Cross Blue Shield provider.
all right. Okay. So, okay. And then now we can kind of move forward with that headache I want to get back to. Okay.
Okay.
Can you tell me about, you said the last week, but that onset's kind of been since you had your hysterectomy or what?
No, I got my flu shot on Saturday and
Okay.
I was fine on Sunday, but Monday it just really hurt at my temples
Okay.
and it just kept getting increasingly worse.
Okay. So that headache's really just kind of right here at that at your temples. Does
Yes.
it radiate anywhere else for you or
It kind of goes down into my eyes. It's like a stabbing pain. Sometimes I feel like I get little floaters that go across.
okay? Do those floaters stay around or are they easily able to?
They usually dissipate after
Okay,
about 10-15 minutes. As long
perfect.
as I have a quiet room,
Okay,
I put a heat pack on.
perfect. All right. Does anything make it worse?
Um, Usually when the kids and the hubby come home from work and it just
It's a little loud.
seems like too much noise and intensity, it just bothers me increasingly so.
Does anything make it better?
Um, well, a quiet dark room.
Okay, perfect. All right. And then do you notice that these come on at any certain time or is it a constant headache?
It usually starts about after lunch,
Okay.
and you know, when I finally fall asleep at 9 o'clock at night, then I don't notice it because it doesn't interfere with my sleeping.
Perfect. All right. And then are these constant or kind of intermittent? Like some days you're good, some days you're bad, some days they're really not, they're there, but not too much.
Um, I would say it's been almost daily
Okay.
since Monday. And
Okay.
since it's Saturday now, I thought, 6 days is long enough
Right.
to
Yeah.
deal with
Let's
this
get
pain.
you taken
So,
care of. Absolutely. All
yeah.
right. And then on a scale of 1 to 10, Cami, what would you say that you would rate that headache?
In the mornings, it's about a 5, but by
Okay.
5 o'clock in the afternoon, it goes up to a 9.
Okay. Perfect. And 10 being the worst, obviously. Okay.
Right.
Perfect. All right.
So, yeah, I remember that pain scale from when I had my kids
Yeah, yeah. We really love it as nurses. It apparently solves all of our problems.
because I
So,
have 2 boys. They're
okay, okay.
um, 20 and 22 now.
Oh, wow. Yeah. All right. You don't look old enough.
Well, thanks.
Okay. So just some past medical history, Cami, I want to run over with you. Again, just like the biographical data, kind of some general history so that we can just get a better knowledge of you. Okay.
Excellent.
Okay, so your past medical history. This kind of includes any major illnesses that you've had. Have you had
You
any
mean
major
like when I broke
illnesses?
my elbow in 4th grade?
Yeah, yeah,
And
yep.
then I had my kids when I was in my 20s. So
All
that
right.
was only the first time I was in the hospital.
Okay. Have you ever been in the hospital for anything else major, not like just to check
Oh
out
yeah.
anything?
In March of 2020 was the second or the third time because I had 2 boys. So August 98 was my first hospital. And
Okay.
then July of 2000 was my second hospital.
Okay.
And then March of 2020 was my last hospitalization.
Okay. All right. What was that last hospitalization? Because you talked about your two kiddos, but
Yep.
then I don't
And
think
then
we
I had
talked
a
about what that.
hysterectomy.
Okay, okay, that's when the hysterectomy
Yep.
happened. I knew you
Yep.
mentioned that earlier. So, okay, perfect. And then, other than your broken elbow, any other injuries that, I mean, were severe enough that we should note?
Um, I missed 10 days of kindergarten when I had the chicken pox.
Oh, yeah, yeah, yeah. Did you have a chicken pox party? Because that was the thing.
Well, of course, because I was the oldest of 5. And so we had our own little pox party going on.
Get it done with. That was the motto then. Thankfully, we have a vaccination for it now, though. So,
Yep.
all right. Okay, any blood transfusions or like disabilities that I need to be aware of?
No blood transfusions.
Okay. All right, perfect. How about any disabilities like blindness, deafness, hard of hearing, anything like that?
No,
No?
none of
Okay,
those at this time.
perfect. And then surgical history, you did say that you had a hysterectomy in 2020. So anything else that you've had surgeries on other than
Oh, I had LASIK surgery when I was 26.
okay, perfect. All right. Were both your children vaginal or did you have a cesarean with them?
Both of them were vaginal.
Perfect. Were they full term?
Yes,
Everything went well with that?
I loved being pregnant. They
Good.
were awesome little kiddos.
Perfect. All right. And then I know you had two full-term births, and it's always a touchy subject, but were there any preterm births, miscarriages, abortions that we need to know?
Nope. The good
No,
Lord was very fortunate to me and didn't have any problems or miscarriages or any other problems.
perfect. I know that can get a little sensitive, so thank you. All right. And then you talked about already having the chicken pox, but how about other immunizations? Are you up to date with those?
Yep.
Your measles, you got the mumps
I had all of my
vaccination.
MMRs and
Okay.
my Hep B series.
Okay.
Um, my last TB test was a year ago through work, and that was
Okay.
negative, of course.
Okay. What do you do for work? Oh, you said you're an educator at the school. Yes,
Yeah.
yes, yes. Okay. Perfect. All right. And then how about like pneumonia shots? Are you on any of those or your
Well, I thought at
immunizations?
45 I didn't have to have it yet.
No, you don't. But you know, some people they start early, so we always like to ask. So, and then you just got your flu shot a week ago.
Yes.
Perfect. All right. And then how about do you have any like psychiatric disorders in that sense, like depression, anxiety, um, mood
Well, my doctor
changes,
gave me
anything like that?
Lexapro for my depression.
Okay, perfect. How long ago did you get diagnosed with that?
Um, well, depends on who you ask. I've probably had it since I was a teenager.
Okay, yep. We kind of get those hormones in us and it sends us every which direction. So, absolutely. All right, anything else that, I mean, moods go up and down? How about PMS? I know you had that hysterectomy. Are you having a lot of hot flashes, getting irritable, anything like that?
Things have been going much better. Um, so the pills that I take every morning are my vitamin B, my vitamin C, my vitamin D, and then at nighttime, then I take my Lexapro and my cholesterol pill.
Okay.
And usually I take 800 milligrams of ibuprofen just to get rid of all of the soreness. And maybe that's what's making my headaches go away at night.
All right, perfect. Okay, so then you just started talking about those medications, which is perfect. That's what I wanted to know. Anything else that you're on other than those that you listed? Any herbal supplements that you may take or
No
anything like
herbals, just
no?
my ibuprofen that I take,
Okay,
maybe once a day.
perfect. And then again, these are standard across the board questions, but any recreational drugs,
Not at this
marijuana,
time.
anything like that? No? Okay, perfect.
No, but I can't live without my cigarettes. I usually smoke about a half a pack of cigarettes a day just because it just calms that anxiety down for me.
All right. Well, if you would like to ever talk about smoking cessation, please let me know and we can definitely get you on board with something like that.
I think
So
I need a support partner with that.
I can understand that. I understand. How about allergies?
No, no allergies,
No, none.
not to
All right. You
food
are
or
lucky.
drugs
No,
or environmental things.
no, nothing.
No,
No. Gosh, you're lucky. This pollen's killing me. So, all righty. And then I know that you came to see us because we're with Blue Cross Blue Shield, but you were also talking about your other physician that you see. When was your last physical examination?
it would have been March of 2020.
Okay. With
And
that
so
hysterectomy.
that was about, yep.
Okay.
And so I went to the dentist that same week. It seemed like I was going to see um, my doctor every day for a week until I went into the hospital. So
Yes. Yeah. They wanted to make sure you were ready to go. And with this darn COVID, I am sure they were keeping a
they were
close eye
pushing me
on you.
through.
Yes, they were keeping a close eye. I'm glad that you got it done before everything shut down.
Right.
So, all right.
So, yep. Monday, I went to go see my primary doctor. Tuesday, I went to see my dentist and had my teeth cleaned. And Wednesday, I went and had my annual eye exam because I don't usually have too many problems. But after my LASIK surgery, they always are keeping an eye to make sure that I'm not having any retinal detachment or something.
Right.
So no problems
Yes.
there. And
Perfect.
then Thursday I saw the surgeon, and by Friday I was ready to go.
Perfect. And then before you had surgery, did you have any kind of like EKG done or a chest x-ray? Kind of more of that heart monitoring. I mean, I guess I shouldn't use those kind of terms unless you're familiar with them.
No, I have never had any heart problems,
Right.
and I haven't had any x-rays other than just my annual one for my mouth.
Okay. All right. How
So
about a mammogram?
um, that's on my to-do list. I thought I'd do the hysterectomy thing first, but
Okay.
with
Perfect.
COVID, I kind of keep it at home.
Yeah, things are getting pushed back, aren't they?
Yes.
So, and then pap test, I'm assuming you did prior to your hysterectomy,
Yes. And
a
that
pap
was done
smear
in
and all that.
January,
Okay,
and that
perfect.
came back normal.
Normal. Perfect. That was my next question. And then have you ever had any issues with like blood in your stools or anything like that that you've had to be tested for
No,
any?
my bowels have been just right as rain.
Okay, perfect. And then any other health maintenance that you would want me to know about?
Nope, I've just been working on getting better quality sleep and having intentional eating and maintaining my healthy weight and
Perfect.
seeing if that helps my anxiety.
Right. You said you were a smoker. Are you a drinker by chance?
Um, Intermittently, but not consistently. I don't usually have more than one glass of wine, and that's usually on date night. And that seems to happen less and less often these days.
Yeah, you would think we would have more of them nowadays, but we just keep getting busier. I don't know. So, all right, let's move to that family history of yours, Cami. I know that you were talking about being Scandinavian and Norwegian. Can you tell me about your grandparents a little bit and their health?
Um,
Let's start with your mother's
my
grandparents.
mother's side,
Yeah.
my mother's dad had diabetes,
Okay.
and my mom's mom had um it started in her ovaries, but then she died of metastasis throughout her body.
Okay, so she
So
had
both
some
of my maternal
ovarian
grandparents are
cancer.
deceased.
Yeah. Okay. Okay. Some
And then my
ovarian.
paternal grandparents,
Yes.
my paternal grandfather had um, uh, pulmonary fibrosis with cardiac, because he
Okay.
ended up dying of complications of a quadruple bypass.
Oh gosh. Yes. Yep.
And
Those
then
are
my paternal grandmother
okay.
had high blood pressure and a series of strokes.
Okay. All right. And then going back to your maternal grandfather, I believe you said had diabetes. Do you know
Yes.
what he died from? Was it the complications of diabetes or?
It probably most likely was, because he
Okay,
had multiple amputations of his toes and then below his knee. And
perfect.
yeah,
All right. And then you said that you were divorced. But the person that you are currently with, does he have any history that or illnesses that you're taking care of or anything like that for him?
uh, no, not at this time.
No, nothing
We're
that
just
stress.
going through middle age together, and
Okay. No
both of us need to
strenuous
quit
activities
smoking.
on your own. Okay. Yeah. All right. How about your children?
Both of them are healthy.
Perfect. All right. No childhood illnesses that you guys had to combat?
No,
No? Okay.
they didn't even have any broken bones.
Wow. You sure they were kids at one time though, right? Like, because usually,
Exactly.
usually they get into mischief. So
Not too much when you just play video games most of your life.
that's true. That's true. So, um, Cami, are
But other
you
than that,
a
I feel like I've been blessed. My family's been quite healthy, and
good?
my
How about
mom
your mom
has
and dad?
high
I
blood
know we
pressure and both of her knees replaced. And
okay, okay,
my dad has extreme anxiety with hoarding behaviors, and he just had spinal fusion and a hip replacement. So
Okay.
they're getting up in their 70s now.
Yeah.
So life
Yeah.
is starting to slow down.
Perfect. Yeah. Yep. It sure does about that age, doesn't it?
It does.
So, all right. And then Tammy, are you a citizen of the United States?
Yep. Always have been.
Perfect. All right. And then do you have any spiritual or religious preferences that you would like us to notate?
I don't go to church, but
Okay.
I have basically a Christian upbringing, and I think self-care and taking care of others and adhering to a lot of those moral and ethical beliefs.
Okay, perfect. All right. And then just how do you perceive your health?
Right now, other than
Yeah.
my headaches, I think that I'm relatively healthy. I know that if I don't continue to exercise and eat my fruits and vegetables, that I could have more complications from that. But
Yeah,
my
let's
appetite's been real good.
good.
Staying at home, it feels like all I do is constantly eat. But we've gotten back to eating more balanced meals, and
Good. What does a daily meal, like daily intake look like for you? What do your meals look like?
I usually have coffee at breakfast and
Okay.
then a salad for lunch, and then my family loves meat and potatoes for dinner.
We are Midwest, aren't we?
Yes.
Oh,
But
all
at
right.
least, my weight's been stable for the last 7 years. So
Okay. How do
I
you
know I
feel
could
about
lose
that?
some
I
weight,
mean,
but
yeah.
170 pounds is where my body likes to stay.
Yep. I understand that completely. But are you satisfied with your weight? Or you don't feel like we need to talk about any weight management or
Um, I think if I stop smoking first, then I'll work on my weight.
I understand that. So, all right.
Because if I don't eat my vegetables, I feel like my gut gets kind of bloated and
So
tight,
that
but
fiber really helps you kind of keep regular and
absolutely.
all that.
Yeah.
Good, perfect. All right. And then how much do you drink of fluid a day? Are you a good water drinker?
I'm
Are
a
you a
good
pop?
water drinker.
All right, there you go. Absolutely. I'm gonna hope that's water.
It is water. I drink about a gallon of water a day. So I
Awesome.
have the prettiest
Awesome.
color pea you've ever seen.
Oh, all right.
Because
All
between the
right. You
B
should teach.
vitamins and the C vitamins, it's like neon yellow.
I might need you to come teach some of my other patients. Yes, we need to work on this water thing for sure. All right. So you said that fiber really helps you with keeping regular.
Yes.
Um, any other qualities of your bowels anything abnormal that you want to
Just
mention?
stay away from De Leon's Mexican. That'll mess your gut right up.
Yep, yep. All right. Do you usually have a bowel movement daily, every other day?
Oh, you have to have one every day. Otherwise, you get cranky and irritable. And apparently, people don't like me when I'm cranky and irritable.
No, no, yeah, I understand that. I have been told that myself. So, all right, how about your bladder? Any unusual characteristics there? Are you able to control your bladder okay? I know after children and all that, it can get a little loose. So, oh, Cammy, I think we lost you for a second. So. We were just talking about your bladder, right? Or we
And
were
everything's normal there.
Okay. All right. Do you have any urgency, frequency, a little bit of incontinence, no stress incontinence?
No, everything is good there.
Perfect. All right. And then living environment, where do you live at? City and
I
state?
live in Lincoln. We bought a house 3 years ago.
Okay.
Been a wonderful experience, and we keep growing as a couple.
I'm assuming that's Lincoln here in Nebraska, correct?
Yeah. Yeah.
All right. And that's more of the larger city. Perfect. All right. And then who all lives with you?
Jason, Caden, and Carter.
Perfect. And Jason is your significant other, correct?
Yes.
And then both of your children, or do you guys have a blended household?
Blended household.
Okay, so one of them is his as well?
Yes.
Okay, perfect. All right. And then do you know of any toxins that you may be exposed to in your living environment?
Nope. Everything is a-okay.
How about in your occupation? I know that you're a teacher, and you're in
We just
education.
moved into a new building, and so it's all been health inspected.
All right. Well, good for you. New building and everything. One good thing out of COVID, huh?
Right?
So, all right. And then how about just daily life? Are you able to get yourself dressed, do all those daily things, drive,
Yep.
work
No
okay?
problems there.
No, hands feeling okay, you're able to grasp and everything?
Yep.
Good, perfect. All right. And then you have a significant other, Jason, and
Yeah.
then two children living with you,
Yes.
correct?
Yes.
Okay. All right. Any other um family dynamic relationships around you that you want to talk about or feel that I need to know?
Nothing that impacts me on a daily basis.
Okay. Do you and Jason kind of make those decisions together, or is it kind of you make the decisions or he makes the decisions, or
It's a joint thing. We both
good?
consider ourselves head of household, so it's very collaborative.
Perfect. How are these headaches affecting your family?
Um, well, it's only been a week. So Jason's kind of taking over a lot of the
Hmm.
cooking in the evenings. So
Good. Good.
I can go in and rest.
Good.
We
Perfect.
we share household duties like that.
Good. That's great. All right. And how about your cognitive function? How do you do with memory? Do you feel like you're forgetting things or are you pretty
I
sharp
I
still?
don't think so.
Okay.
If so, I've
Nobody's been like,
forgotten
I
so
told you
diligently,
this a
I don't
hundred
even know.
times. Okay. Nobody's like, you're forgetting things, mom.
Nope.
Nothing like that? No. Okay. All right. And then speech, do you ever find yourself slurring your words with your headaches or anything like that?
I haven't noticed anything.
No, you're pretty clear with your speech.
At least I hope so.
Right. Yeah, we all do. So far, so good on my end. All right. And how about your senses? Are you able to still smell?
Yeah, because isn't that a COVID symptom?
It can be, absolutely. How about tasting? Are you able to taste your food that you make?
Oh, absolutely.
Perfect. All right. And then all your other senses, touching, feeling,
Yep,
hearing,
no
all that,
impediments
you're
in
okay. So,
touching, feeling, smelling,
good.
hearing, seeing,
Yeah, all of them.
all of them.
Good. All right. And then your sleep patterns. Do you take any naps during the day?
Not typically. Usually I'm too busy to take a nap.
Perfect. Yeah. How many pillows do you use at night?
Um, I usually use two, one for my head and one to put between my legs.
All right. All right. So any other aids for sleep? Any
Um,
medications or anything
nope,
like that?
I usually drink a cup of hot water before bed and
Okay.
I'm out like a light.
All right. Perfect. How long do you usually sleep at night?
I try to get at least 7.5 to 8 hours a night.
Right. I knew you had talked about getting back on the bandwagon of exercise and eating well and doing all that. How often do you exercise?
Well, I think you told me once that you had a dog, and so those
Yeah.
dogs need a walk every single night. So
Yes.
I walk at least a mile every night. So
Good.
a little bit of something is better than
Good.
nothing.
Yes, those dogs, they keep us healthy, I think. Yeah. They're good for that.
Yes,
So, all right. And then, so you go about every night with them?
absolutely.
All right. If it's anything like my dog, we don't go far before we have to pee on a tree. So, all
Yes, yes.
right.
Got to
Are you
mark your
able to,
territory.
right. Are you able to do anything else exercise what? wise that gets up your heart rate and kind of keeps it there since the dogs might be
Um,
stopping and
I do
starting
like
that
to
walk?
garden.
Okay. All right.
So if we're having to clean out the yard or something, that usually gets my heart a pumping and
Yeah.
sweat a dripping. So I figure that's better than going to the gym because I've never been one to go to the gym.
I hurt so bad after yard work. So it has to be doing something, right?
It has to
Yeah,
be.
absolutely. I agree. All right. How about hobbies? You said and recreation, you like to garden. Do you do anything else?
Um, I haven't had the opportunity to travel.
Okay.
I really wanted to, you know, drive someplace and go to the mountains, but haven't been able to do that for 5 years.
I was
But
gonna say this year is not the year, and I don't know if 2021 is gonna look like the year either. So,
no, so
dang it.
as
So
far as
you're
hobbies,
gardening.
it's watching TV and gardening. That's about the extent of my hobbies.
All right, learning a lot with that gardening. Then I bet this year, kind of stuck in one place.
Yes,
Good, good. All right. And then we already talked about your tobacco and alcohol, and you
yeah,
smoke about a half a pack a day, but not really a big drinker, more water. And you said more of that social drinking for alcohol, correct?
correct.
Okay, perfect. All right. When you drink, what kind of alcohol do you drink?
Usually I like white wine.
Okay, good, good. All right. And then again, it's everybody, but we always like to ask, and especially during this hard time of COVID when everybody's roomed in, staying in place, and there's just a lot of stress with families and environments. But do you feel safe at home? Is
It's
anybody
the
hurting
safest
you?
place to be.
Okay, nobody is hurting you, or there is nothing that
No,
you would
we
like to
hardly ever
discuss.
yell at each other, and um, I did all of the mental anguish when I was in my 20s with my first husband. So
Yeah,
this
yeah,
is
that's
glorious
screaming and
bliss
yelling.
right now.
Okay. All right. Well, just so you know, this is always a safe place if you do have something that you would like to talk about.
Well, I
So,
appreciate that,
yeah,
Cassidy. Thank you.
absolutely. All right. And then how are you coping with everything?
Um, I think fairly well. I I firmly believe that everybody doing their part and staying home and doing self-care activities that mean something to them, I think that's the best stress management you probably could have.
Yeah, yeah, absolutely. In the past 2 years, I mean, you've had a hysterectomy. Now we've got COVID. Kind of a lot has happened in 2 years. How do you feel that these 2 years have treated you? And
Well, I just feel blessed to have my health and my mental sanity and a
good.
stable partner. And, that's one of the best things about having a hysterectomy and being quarantined at home. You can just have a little bit of fun, quiet time with the hubby. And
Yeah,
it's kind of increased a lot lately
good.
in these cold nights that it's a lot of fun.
Good. All right. No tension. You don't feel an increased tension or anything
No,
like that at home. You're doing good.
we are
Okay.
doing excellent.
Perfect. All right. And then obviously you're quarantined a lot with your hubby at home.
Yeah.
So sexual patterns, are you sexually active? Obviously, I'm
Oh,
assuming
yeah.
your
And
little
it is
winks are
probably
giving it
up to
away.
about
Okay.
2, 3 times a week now.
Okay. Okay. All right. And then obviously Jason is a male. Am I
Yeah.
going to assume that's correct? All right, perfect. And then has anything changed about your sexual health or anything like that? Health
No,
and function?
we're
No,
very
no.
devoted over the last 10 years. It's been
Good,
wonderful.
good. I'm sure COVID has increased that for you guys, getting you a little bit closer. So, okay. So now, Cami, we're just going to kind of run through some of that general head to toe assessment. I'm not going to have to do any listening or anything. So it's really just how you feel about it all. It's personal data that I want to know. Okay. All
Okay.
right. So in general, you said that your weight pretty much maintained the last 10 years. You've stayed pretty steady. All right. Any fatigue, weakness, fevers that you're aware of
No,
that are just like of unknown origin? Okay. All right. Perfect. And then how about your skin? How's your skin? Any lumps, rashes, sores, itching,
no.
dryness? No
All
color
that
changes of
alcohol makes my
moles or
hands
anything?
dry, but
Yeah.
you
Yep.
have to put lotion on before you go to bed.
Yep. Drink that gallon of water and you'll replenish it. So
Hmm.
perfect. All right. And then no changes that you've noticed in like moles or like your hair, your skin, or your nail
No,
beds or cracking
no,
or anything.
my freckles are still here.
Yep, yep. I have those too. I cover them.
Hmm.
So, all right. And then how about your head? You have your headache that has increased over this last week.
Just the past week.
Okay, but is it something that you've had in the past? Like, is this a thing that you've had before, like a migraine that's kind of hanging around more? Are you susceptible to migraines or
Um, I used to be susceptible to migraines when I was in my 20s. I always
okay,
thought it was probably hormone related.
okay,
So,
perfect. All right. And then have you ever hurt your head, had any head injuries um that we need to be aware of?
no,
No? Okay. Dizziness or loss of balance?
no.
No. Okay. All right. And then your eyes. You said that you had LASIK.
Yeah,
So,
I'm still 2020, but getting to be older, sometimes you need a little bifocals to help you out there.
yep, yep. I haven't had LASIK and I still have them. So,
Yep.
all right. Any eye pain?
Just sometimes I get those sharp
The sharp.
shooting pains this week.
Perfect. All right. Redness or swelling of your eyes at all?
No,
No, okay. Corrective lenses, I know that you said that you're 2020, but you don't wear any kind of,
just bifocals when I,
okay. And your last
because
eye
that
exam you
accommodation
did,
is getting kind of challenging in my 40s. I
yes.
can't play
And
Candy Crush and watch Criminal Minds at the same time.
oh, but we are gonna try.
Yeah,
Absolutely. I am gonna try every time. All right. And then your last eye exam was that same week of your hysterectomy, correct?
yeah.
Perfect. So no blurred vision, but you do have floaters, you said. With these headaches, you kind of see spots and they kind of, now do those spots, they kind of float and they gravitate, or do you all of a sudden just lose a spot of vision, like a black hole or a
No black
fuzzy,
holes. It's
okay,
more like, dandelion seeds that are just floating all the way
kind of
across.
floating around. Okay, okay, perfect. And you said that dissipates if you close your eyes, just relax in a dark room.
Quiet, cold, dark room.
Okay, perfect. All right. Then your ears, no change in hearing.
No,
All right. Any ringing of the ears or earaches?
no,
No. Any infections or discharge that I need to be aware of? That
no, that was all back in the childhood.
perfect. And then did you ever have tubes in those ears back in
No,
the okay, perfect. Hearing loss?
nope,
No, so you do not use hearing aids, correct?
correct.
All right. Okay, so now going on to your nose and sinuses. Um, frequent colds or congestion?
No,
No. How about nasal obstruction? Do you just feel like you always have something in your nose and
just when
you
I
just
have
kind
to
of,
wear my mask.
oh gosh, yes. Yep. It's like a constant feeling that something's there, even when it's off. All
Right.
right.
So my nose and my sinuses, my mouth, that's all good.
Perfect. All right. Um, itching, hay fever. You said no allergies.
No allergies.
Okay. And you still can smell. You don't
Yep.
have tons of sinus pain though, right? You
No,
just kind of, okay, perfect. All right. And then nosebleeds, you're not having tons of nosebleeds that
no,
won't stop or anything like that. All right. Perfect. And then you said your mouth and your throat, everything looks good, but bleeding gums, mouth pain, toothaches, nothing like that. Okay.
no,
You don't have any lesions in your mouth. You don't wear dentures,
nope.
anything
All
like
natural teeth.
perfect. Sore gut, your tongue doesn't get sore or you don't have a dry mouth on occasions. Like
No,
that's a chronic thing? No?
No
Okay.
chronic.
No sore throats that I need to be aware of, hoarseness, tonsillectomy?
No.
Okay.
Otherwise, I'd be coming in for a COVID test. But
Right. And so you're still tasting that food.
yes,
Okay. Dental exam was again the same week of your
yeah,
hysterectomy. Okay. All right. And then your neck, you haven't felt any lumps or enlarged lymph nodes lately, have
no,
you? Like if you're just holding on to that neck, there's nothing there that you're feeling
can't
funny
feel
with.
any lumps, bumps, or
Okay. All right. Then you don't have a sore throat, so that would kind of go along with it. Perfect. All
right.
right. And then when you go like this with your hands, when you go down the top of your neck, you don't have a big lump right there, or you feel a big knot. Nope, you don't have a goiter that
No,
anybody has told you of. Okay, perfect. And then no pain, no neck stiffness. You feel like
no,
you can move it around pretty well. No
no
range of motion
problems.
difficulties. Perfect. All right. Okay. And so then the breast, I know you said that that mammogram was on your list to do, but how about any lumps that you have felt with your
No,
breast exam? Do you
no,
do
because
monthly?
my gynecologist said that I needed to still do it, and
Mhm.
so I examine them every morning in the shower. And
Okay.
my
All right.
partner hasn't said
Hasn't
anything
said
that it's
anything. Okay.
changed
So,
or
all right. So no nipple discharge or anything like that,
no,
rashes. Okay. No surgeries for breast augmentation or
not yet.
no, on your list to do, huh? All right. Okay.
50th
Any
birthday.
All right. All right. Something to look forward to. All right. So, history of breast disease, that is including you or your family. So, I know that we talked about your grandparents and your mom and your dad, but you didn't mention that they had any kind of a breast issue.
No, no
No.
breast issues.
Okay. All right. And then you said that you do a daily self breast examination, or at least in the shower. So, that's great. Um, and you are free from anything of that. You don't have a rash in that axilla area, that armpit. You don't ever see like
Mm-mm.
a rashy look. No.
No,
Okay. Perfect. Okay. And then your lungs. Any cough that I need to be aware of?
nope.
Okay.
Even though I smoke a half a pack of cigarettes a day, no cough,
No.
um, no
No
shortness of
happy
breath.
cough.
I
Okay.
still have been running up and down the stairs all day doing laundry.
Good.
I've
When
never
you're
had
going
to
up
go
and
get a chest x-ray or anything like that. So
perfect. No pain when you're breathing. Like it's almost like you feel like you're rubbing up against like your chest just can't.
no, because then I'd be scared I had COVID.
Right, that's true. Okay. And then no lung disease. So
No lung disease, no
perfect.
heart disease. My heart's full of love right now. The only time I ever get heart palpitations is when my hubby walks in the room.
Oh, is he sitting beside you? Is that,
No,
oh, that's too cute then. All right. And then so no cardiac issues, but you do not get dizzy when you change positions, like if you go from sitting to standing quickly, nothing like that.
no,
Okay, perfect. You don't have any like edema in your feet that you're like
nope.
any
I haven't
swelling
had
like
any
that?
swelling since I was pregnant.
All right, good. Yeah, they like to swell, don't they? All
Yes.
right. Any cyanosis that you're aware of? Any like if you're looking in the mirror, you're like, oh, my lips are kind of bluish purple, or your fingertips get a little bit discolored, anything like that?
Nope, nothing
Nope.
like that.
All right. And then any like urination through the night. Are you having to get up a lot and go to the
Oh,
bathroom or?
heavens, no. Nope,
Okay,
that was
perfect.
all
And
good.
then you've never been told anything about any cardiac murmurs,
Nope,
no anemia, no hypertension that you're aware of?
nope,
Okay, and no coronary artery disease.
nope.
Perfect. Because you did say that you take a cholesterol medication,
Yes.
and then you have, with your physical examination, they have done a recent cholesterol level, correct?
Um, it's been about 6 months,
But
but it was
okay,
about 235.
Okay, perfect. All right. And then you said that your appetite's been pretty decent. No huge change in that at all.
No,
No, okay. You haven't noticed any yellowish color to your skin or anything like that, have
no,
you? Perfect. All right. And then any nausea, vomiting?
no,
No.
none of that.
Anything, any dysphagia? Is it hard for you to swallow?
Oh, no,
No, no. How
that's my
about
gallon of
heartburn?
water.
How about heartburn? Do you have any issues with heartburn?
No, sure
No,
don't.
okay, no stomach pain. You're not having excessive belching or farting that you're kind of worried about.
No,
No. All right, perfect. No change in bowel habits.
no.
All
We already
right.
talked about all of
Yep, yep,
those, and
yep. You're doing good there then. All right. And then no intolerance to food that you're aware of.
no,
Perfect. Okay. And then I know that we talk go every day. Daily ounce isn't good for you, but any other constipation or diarrhea issues?
no.
Okay. All right. And then bear with me. I know these are a lot of questions, but it'll give us a great history on you. So the next time I talk to you, we can get right to what we need to talk about. All right. So again, with your bladder, there was no urgency. You don't have any like, I thought I had to go. Now I can't. Anything like that. No incontinence, no
No,
blood in your urine. You have never noticed blood in your urine.
no, never.
Okay, perfect. All right. And then after childbirth, did you ever complete those Kegel exercises, kind of where that help build the pelvic floor?
Oh
But
yeah, I still do those at the stoplight every time that I'm out driving.
there you
That's
go.
what my Lamaze coach said,
Yeah, yeah. All the way through the reds, and then you go, right?
right?
So, all right. And then how about birth control? I know you've had a hysterectomy. So prior to
Yep.
the hysterectomy, were you using birth control?
No,
No. Okay, perfect. Any HIV exposure?
no.
When did you start your period?
When I was 15,
Okay, perfect. And then did you have pretty heavy periods or what led to that
very much so.
hysterectomy? Okay,
Yeah.
heavy periods, bloating, cramping, all of that. All right.
And uterine polyps.
Okay, uterine polyps. All right. Perfect. And then I know that now that you've had the hysterectomy, how are the hot flashes?
Nope, no
No,
hot
no.
flashes.
All right. And then you said that you have an estrogen patch, correct? Is
Yes,
that what you are using to manage your hormonal fluctuations through this
right.
time?
Changed
Perfect.
twice a week.
All right. Do you have any kind of discomfort down there, vaginal dryness, anything like that post?
Nope.
All right. Perfect. All
Synthetic
right.
hormones are awesome.
Awesome. Yeah. Yeah. They can do wonders, can't they? So, all right. And then do you ever have the feeling of being extremely cold all the time or any tingling in your hands and feet like that?
Nope,
Coldness, tingling? No. All right. Any numbness, leg cramps that you know of?
nope.
All
Everything's
right.
been good.
All right. And you've never had any kind of a blood clot issue?
Never.
Never. Okay. How about varicose veins? We're both kind of, we got to thank our grandmas for that. At least I do. So, how about you? Do you have any varicose vein issues?
Um, Truthfully, I haven't looked, but they've not been bothersome. So
Okay. Perfect.
nobody's ever said that I've got them. So now you're going to make me want to go look.
Oh, I don't have to look. They're there. Okay. So, and then you said no to the discolorations of your hands and no ulcers that you're aware of.
No,
Okay.
I'm good.
Perfect. All right. And then joint pain. Any muscle or joint pain that we need to talk about?
Um, no, sometimes I'm a little sore from just physical exertion during the day and
Perfect. And that
joint pain.
ibuprofen you take at night takes care of it
Yeah,
decently? Okay, perfect. Any cramping that you're aware of? Like
none.
all of a sudden your muscles just tighten up and they just won't let go. Okay, perfect. Joint stiffness, arthritis, or gout?
Nope, those are
Oh,
old people diseases. I don't have those.
all right. 45 and holding, right?
That's right.
Okay.
21
No,
forever.
24. I stopped there. So,
Okay.
All right. Limitation of movement.
None.
None. All right. And then no disc disease or any spinal issues.
Nope. That was all
Perfect.
belong to my dad.
Okay. All right. All right. And then just going on to that neurological exam. Syncope. So do you ever faint
Never.
for no
I have
reason? Okay. All right. Seizures. Have you ever had a history of seizures?
nope.
Okay. Any weakness or paralysis?
None.
No history of stroke?
Nope. Just my
Okay.
paternal grandmother.
Okay, perfect. And then again, you said no numbness or tingling of any kind of body part. Perfect.
None.
All right. Tremors or tics? Do you ever see like seem to kind of twitch or anything like that that you're aware of?
Honey, you just look like you're flirting with me. I
Heh,
haven't had a
heh.
tick like that for years.
Good. Good. You already got your you already got your man, right?
That's right.
And then so no involuntary movements that you're aware of, like your
None.
hand. Okay. All right. Coordination, you're doing all right?
So far, so good.
Perfect. All
So
right.
you can put me on
And
a treadmill.
yeah, I just stopped walking one day and apparently it kept going. So that's a true story. Um, so you said no to any memory disorders or mood changes, correct?
Correct.
All right. And then no history of mental disorders or hallucinations other than the depression and anxiety that we talked about with the Lexapro.
Right.
Okay, perfect.
And those are
All right,
getting better.
good. Good. And then no anemia. You're not bruising easily or bleeding for no reason and not being able to control it.
That would be scary.
Yes, it would. We said no to blood transfusions, and so obviously you have no reactions to them. No lymph node swellings, and you really haven't been exposed to any toxic agents or radiations that you're aware of.
Nope.
Okay. All right, and then you are fine. You do not have any heat or cold intolerance, correct?
Correct.
All right. And then you do not excessively sweat for no reason.
Nope.
Perfect. All right. And then you are able to swallow fine. You're able to do all that. Your bladder is okay. We're doing good. All
We
right.
are
Perfect.
doing good.
Okay. And
So it's
then,
just those headaches. Otherwise,
yes, yes. No thyroid disease, diabetes, or well, your hormone replacement, you do estrogen. Now, do you do an estrogen progesterone combo
nope.
or just
Nope.
estrogen?
Just straight estrogen.
Okay, and that has not changed any of your hair distribution or anything that you've noticed with just that increase of only estrogen, correct?
Yes.
Okay, perfect. All right. And then other than your anxiety, do you have like a nervousness that you're
No, as long as stupid people stay out of my face, my anxiety basically stays in check.
perfect? And then no memory changes that you're aware of. Nobody has told you yet,
Nobody's
at
told
least.
me anything like that. I haven't lost my way in life.
Okay. All right. And then you have never had any suicide attempts, have you?
No.
Perfect. All right. And then you have never had any thoughts or feelings towards suicide.
Correct.
All right. Perfect. All right. So then, Tammy, those headaches, darn it, you've had a little bit of a history of migraines in the past, correct?
Um, very
In your
remotely. I
20s,
was
in your
in my 20s.
20s. Yeah.
So
So,
half a lifetime ago.
yeah. Yeah. So I definitely think we need to look more into that. And then we can definitely further go into if we think maybe they're just headaches caused by the weather changes, that flu shot may be a little bit of a side effect.
Okay.
Um, that is a side effect that some people kind of get is just headaches for a little bit of time, getting used to that antigen that's now in their bodies. So I definitely think if they're going away with just that relaxation, minimal medication, you're not seeming to increase in that ibuprofen, correct?
Correct.
All right. And then possibly maybe let's try and see if when you wake up in the morning, let's see if we can take maybe some ibuprofen maybe around breakfast time and see if that helps get those migraines or
So
those
then take
headaches.
it twice a day then.
Yeah, yeah. So then morning and night. And let's see if those over-the-counter medications kind of take care of it because it doesn't seem like running through your history and the things that you're telling me, it doesn't seem like there is a need for any kind of a COVID test. And it doesn't seem like you're having any further eye or memory issues that I would be concerned with, and no facial sensations for a possible sinus infection. So
Great.
I think I definitely
Thank
think
you for
maybe
your
just
time today, Cassidy. I
yeah,
appreciate it.
absolutely. Thank you.